Spacelifting, a story of one patient. Irene, 49 years old, transformation.
My work involves interacting with all sorts of people, so I try to keep an eye on my appearance. However, lately, when looking in the mirror, I began to notice the not-so-positive changes in my face, which naturally is not pleasing. Moreover, being a cosmetologist, I can professionally assess which procedures might be most effective in my case. I had no particular concerns about possible surgery. When I realized that simple measures were no longer effective, I decided to visit a plastic surgery clinic. I chose the Beauty Space clinic in Moscow because it has many good references.
Irene, hello.
Good morning.
How are you doing today?
Good, thank you.
Are you ready?
Well, I'm a little bit nervous.
We will be going through doing a major surgical 3-step procedure. I would like to start by expressing my views on your last request from our email correspondence. You've also mentioned that you'd like to change the tip of your nose and maybe a nasal arch. However, correcting the nasal arch will require change in rhinoplasty technique. Our surgical procedure will be more extensive. It's going to be called open rhinoplasty, which means the dissection of fragments of the nasal arch. Now we draw a line along the center of the arch. To narrow the arch, we will have to remove bone fragments here and try to make the shape of the nose as symmetrical as possible. Here's what we need to be removed. These are bone fragments in the root area of the nose and cartilage fragments of the arch. Open rhinoplasty is a fairly extensive surgery technique, so I suggest you limit yourself to just changing the shape of the nose tip. We will narrow the tip by removing some of cartilage structures in its part of the end. In this case, the approach is less traumatic, so it's called like closed access rhinoplasty. This means the surgeon makes all incisions inside nasal cavity. Therefore, there are no traumatic traces left outside. I would like to add something else. Looking at your profile, I can see that we might need to get a slightly raised nose tip and increase the angle between the skin part of the nose septum columella and the upper lip. In your case, it will be achieved by making a small rotation of the nose tip, due to which, in addition to correction the cartilage section, a small decrease of the arch will also be obtained. Then, for the tip of the nose to be raised to the desired degree, we usually partake in photos during the surgery. Based on these photos, we make up clear and the full plan of the surgical procedure. We will start with upper blephs. Then there will be no displacement of marking that we will draw on your face now. After that, we'll do the rhinoplasty and do all necessary procedures. The plaster will not be required after nose surgery in your case. We'll just introduce splints so the mucus takes up the right position. These are the special nasal splints through which you will be able to breathe. After that, we will proceed with facelift. We won't make the cuts in the right ear lap area to keep the skin intact. If everything is fine, we'll leave the sutures for 3 to 4 days for better fixing. This is how the ear lap will remain in the depressed position. A small hematoma on the neck will soon disappear. You have to be assigned physiotherapy treatment during your rehabilitation. It's a kind of microcurrent which shortens the recovery period. Since you have had a complex surgery including facelift, rhinoplasty, and upper blepharoplasty, the recovery will take a little bit longer than usual. The ear tragus look very natural, and I really like the outline.
2 months after the surgery, Dr. Olga Nossova performed a zonal facial tightening according to the latest worldwide approved technique called SpaceLifting, which other clinics in Russia haven't yet mastered, as well as upper blepharoplasty and rhinoplasty of the nose tip. I can see great results already. I like the face I'm currently seeing in the mirror. 2 months is not a long time, so I hope when the tissues finally recover, I will look even better. Right now, I don't doubt that my decision to go through with such a complex operation was the right one. After consultation with Dr. Nossova and discussion of the surgery details, I came to the clinic completely calm, confident, knowing that everything will go well and the result will be excellent. Internally, I was ready to endure all the problems of rehabilitation. It's not easy. Of course, there was swelling and bruises and also a slight headache, but it all comes through in the end. And then you simply forget about all the heartbeats. Everyone who knew about my surgery supported me throughout the process. Some girlfriends even came to visit me when my head was still in the dressings. To them I became a real hero. While everyone talks about plastic surgery, few are determined to have surgical facial improvements. Those who didn't know about my operation can't understand why I look different. I even seem to have gotten younger. I don't deny the fact of the surgery. If I'm asked, I share my experiences and feelings without a shade of embarrassment. However, I don't like to brag about the fact of getting a facial surgical procedure and my new face in public. Though I believe there's nothing to hide. On the contrary, it's very cool. My husband was very positive about the whole thing. He supported me from the start. From the second day after the surgery, he helped me remove the bandages and even helped wash my head for the first time. He has always been near and supported me. And now he looks at me with a lot of love and is incredibly caring, as if we have just met. It's very nice. I realized that if you want to change something in your appearance, you have to make a bold decision. Most importantly, you need to find the right clinic and make good contact with your doctor, who should inspire confidence as a professional. It's also important to prepare yourself internally to tune in to get the best results, and everything will be fine.